The Food and Drug Administration is also taking action on fluoride. The FDA recently announced it is conducting scientific reviews on ingestible fluoride supplements for children with the aim of removing them from the market. To help us understand the ongoing debate about fluoride and some of the potential health concerns associated with the mineral, we are joined by Dr. Ashley Malin, an assistant professor of epidemiology with the University of Florida. Dr. Malin, thank you for joining us.
Yeah, thank you for having me.
So I was looking at some federal data that showed about 3/4 of the U.S. population in 2022 had fluoride added to their drinking water. For years, we've been hearing that fluoride has a lot of benefits to our children's teeth. And now there's so much debate about what the research really says, both the impacts, both good and bad, on our bodies. Is there good reason for the debate right now?
Absolutely. So there has been a lot of new research on the impacts of fluoride exposure on the developing brain that has been published in the last 10 years and really even in the last year. So as scientists and policymakers are learning more about potential impacts of fluoride exposure on the developing brain, these, discussions around policy change are also happening.
So I understand you've actually conducted research on the impact of fluoride and the potential connection to neurodevelopmental issues. I know one of those areas is ADHD. Tell us about what your research found.
Sure. So I conducted the first human study on fluoride exposure and ADHD that was published in 2015. We found that states in which a greater proportion of people received fluoridated water also had more children with ADHD diagnoses. And then I led a study that followed up on this question. It was published last year, last May, in the journal JAMA Network Open, and we found that higher prenatal fluoride exposure was associated with more neurobehavioral problems in 3-year-old children who were living in Los Angeles, California.
And were these levels considered maybe higher than average, the amount of fluoride in the water levels?
No, so that's the thing. These pregnant women were exposed to typical fluoride levels that, pregnant women in North America in fluoridated communities typically encounter.
I know another area you looked at was childhood sleep patterns and the potential impact that fluoride had. What did you find?
Yeah, so we looked at fluoride exposure and sleep in among adolescents in the National Health and Nutrition Examination Survey. We found that higher exposure to fluoride in drinking water was associated with higher odds of reporting symptoms consistent with sleep apnea, as well as other changes in sleeping patterns.
So I know there's been, a lot of discussion about the benefits to children and their dental health. There was a Canadian study that looked at the impact of fluoride at two cities, one city who had it, one didn't, Edmonton versus Calgary. The study found that 65% of Calgary children had one or more cavities in their baby teeth compared to 55% in Edmonton. And because of that, Calgary in 2021 decided to bring back fluoride to their drinking water. I know you're not a dentist, but is there any debate that you think is reasonable when it comes to the actual benefits from, a dental health perspective?
Yeah, I think that's an important question. So it's widely established, that brushing with fluoride is beneficial for teeth. I'm putting it on the teeth, so topical application. But now there is more debate around whether ingesting it is also beneficial for teeth. And there was a recent Cochrane review that was published last fall, and that review found that the potential benefit of community fluoridation for reducing dental caries was potentially, a lot weaker now than it used to be before 1975. So looking at the research after 1975, they found it was associated with about a quarter reduction in dental cavities, a quarter tooth reduction, I should say, in dental cavities for children. They didn't have any evidence of a benefit for adults. And even the data looking at potential income disparities in the benefit of community fluoridation for reducing cavities. So whether fluoridation helps, people in low income communities who may be disproportionately affected by dental cavities. That evidence was also quite weak.
Your thoughts on a state lawmaker's decision to ban putting fluoride in public drinking water?
Look, this is a major policy change, and it's one that is going to protect the brains of children in Florida from unreasonable risk of harm.
Dr. Malin, we so appreciate your time. Thank you very much.
Thank you.
Thanks for watching. We've got more great content for you, from news to the arts to the environment. So be sure to like and subscribe to WGCU's YouTube channel and follow us on our social media platforms for the stories that matter to you.